عندي رقمك قلت لا مو أنا بس اتصل على خالد. لا خلاص. صور اللي آخر تصوير اللمس كله.
This is radial artery. Okay. This is radial artery. Okay. See that? This is radial artery. Okay. And you can feel the pulsations of the radial artery like this here. So this is the radial artery. Okay. Median nerve is here. This one. This one. Yeah. You see?
Deep, huh?
Yeah, it's just deep. It should come from the neurovascular bundle. Can you see now? This is the median nerve. It goes under the retinaculum and then it divides into branches and spreads.
So basically, how you differentiate between the nerve, artery?
Nerve is harder and more opaque or more whitish. The artery is softer and sometimes you can see blood inside it and it is very soft. And it is almost round or oval in profile. Nerve is very tough, very hard. Tendon is shiny, it is white and shiny because collagen type 4 shines.
Can we differentiate the natural deviation?
Here? Okay, this joint is flexed. Okay? And this is medial side, this lateral side. So this is here. This is the nerve. Right. This is the artery which is here and this is the tendon. So this is nerve, this is artery and this is tendon. It is difficult here because the joint is flexed. This is a specimen as compared to this one which is straightforward. So nerve, artery, tendon. These are more in number because of vascular branches. See, the artery is giving lot of branches, so it appears more in number. And superficial veins are also included. Okay, these are the superficial veins. Okay, can you see this? Solve your problem. This is the median cubital vein visible here, right? This is your basilic vein here. So, and these are your brachial veins here. Okay, and so now it's clear. This is your nerve. Okay, artery and its vena committantis. Okay,
This is artery?
yeah, and then this is tendon. Artery has got veins around, so they have preserved veins here and not preserved there.
This is the nerve, okay?
Yeah, no, this is the nerve.
This is artery.
First is nerve, so this is the nerve, then this is artery with accompanying veins. These are superficial veins, and this is the tendon. This is a little bit difficult. That's why I add more structure so you are confused. Can you palpate this? Very hard. It's nerve. So from medial to lateral side, nerve first, then artery. So this is soft. You can palpate it. It's soft. Okay, little bit soft, and then this is tendon. So nerve, vessels, and tendons. Okay, see, this is the most difficult bone to tell which side does it belong. But there is a hint. If you know it, it is most easy to hold it in anatomical position. If you know the hint, you can close the eyes and say this is that, that. Okay. So this is the head upper end, this is the lower end, right? So I can close my eyes and say this is the left side. This is the hint here. In the lower part, you got two things. One is the articulating surface. Behind the articulating surface there is a pit where you can put the thumb tip like this. Okay, right? If you have to hold this bone like this. Okay, but the main point is that the articulating surface should always face anterior, and it should be directed on the medial side for one good reason, because it has to make contact with the tibia, which is medial bone. Am I right? Okay, I can hold in thumb. Now this is behind, this is in front, but now instead of this facing internally or medially, this is facing outside, which means tibia should be outside, so that is wrong. So you just take the bone, see its head and the malleolus, keep the head up and catch hold of the tip. If it fits in your left hand, this is left sided bone. If it fits on your right hand, right sided. Very simple. So now, just a minute, just wait, I am coming to you. If you know this point now, you can also describe total bone, surfaces, borders. So medially this is your intraosseous border, intraosseous membrane will be attached. Posteriorly this is your posterior border. Anteriorly this is your anterior border. Three borders, so three surfaces. This is the lateral surface between anterior and posterior border, where your peroneal muscles will be attached. This is anterior surface where the extensor muscles will be attached. And this is the posterior surface where flexors will be attached. Leg, everything is because of rotation. So if you know this point, you can not only hold it in correct anatomical position and find to which side it belongs, as well as you can also describe three surfaces, three borders. Okay. Simple. Yeah. So where was what was your question? Somebody hand up. This is
right.
okay. Yes. Very good. Very good. Excellent. Mumtaz. Very good. Now you are master. Right? This one?
Right.
Left. This is right. Excellent. Mumtaz. This is the most difficult. If you don't know this point, mushkil.
What is the brachioradialis and extensor carpi-radialis longus?
Okay. This is brachioradialis.
This is the most fish.
Yeah. And this is extensor carpi-radialis longus. Okay. And below that is extensor carpi-radialis brevis. Three muscles on this border, lateral border. Brachioradialis, extensor carpi-radialis longus, and extensor carpi-radialis brevis.
This is digitorum, extensor digitorum.
Yeah, and then if you are counting this, always start from little finger side. Otherwise, you will be totally confused. Because from little finger side, it is easier. So this is extensor carpi ulnaris. The first will be extensor carpi ulnaris.
Okay.
Am I right?
I think
Why ulnaris? Because it is close to ulna. This is your epicondyle.
okay.
This is your lateral styloid process. Similarly, on this side is the medial epicondyle. Okay, medial epicondyle. This is medial styloid process, and then you have got lateral epicondyle, and that is the lateral styloid. This is lateral epicondyle, and the extensors arise from lateral epicondyle. So first is this one. Can you see?
Yes.
Extensor carpi ulnaris, and then this is extensor digitorum. Divides into four tendons. Okay, 1, 2, 3, 4. Okay, so extensor digitorum, and then there is this muscle here. it goes to the index finger. This is the extensor indicis. So extensor carpi ulnaris, extensor digitorum, extensor indicis, and then you are having some muscles here. Okay. This is extensor pollicis longus. It goes up to distal phalanx. Extensor pollicis longus, and then you have got extensor pollicis brevis, and then you have got abductor pollicis. Okay. Now it becomes easier. If you start from here, then it's difficult. But if you remember, then it will be easier. Abductor pollicis, extensor pollicis brevis, extensor pollicis longus. Okay, and then this is the extensor carpi radialis. Extensor carpi radialis. Right? Then extensor indicis, extensor digitorum, extensor carpi ulnaris.
What is the extensor digiti minimi?
Extensor digiti minimi is you see three tendons here. This is extensor digitorum,
Okay.
and this is extensor carpi ulnaris, and this other part is extensor digiti minimi. You are having two things, no? Extensor digitorum is here, and this is your extensor digiti minimi. Yeah, now makes sense. Yeah, but this is extensor carpi ulnaris.
Here is not prominent. Here, extensor digiti minimi.
It's very deep.
Because
We can't. We can appreciate the tendon, but it could be this one. Could be. Pardon. Gluteal region. Very good. Very good. If you just uncover, this is the gluteus maximus.
Yes, what is this?
If you open this, it is like you open the door.
Yes.
You can see inside, complete region here. And when you see the complete region, the first and most important structure to be noted is piriformis, which is a key structure of the gluteal region. Okay, so the identification of piriformis is, you just see the sciatic nerve, and just above the sciatic nerve, this muscle is piriformis. Okay, the piriformis forms the key structure, or the most important structure of the gluteal region. Why it is most important? Because through this landmark you can identify other structures, because there are some structures which pass under piriformis, come out under piriformis, come out from pelvis and enter in the gluteal region under the piriformis. There are some structures which come over the or above the piriformis. Okay, so the structures which are coming above the piriformis are superior gluteal vessels and superior gluteal vessels means artery and nerves, and superior gluteal nerves. Okay, and below the piriformis you have got the sciatic nerve, inferior gluteal vessels and inferior gluteal nerve. Okay, the pudendal nerve, internal pudendal vessels. Okay, these are coming here. They will again enter into the pelvis and will go and they will be served there. So they appear for a short while the other structures like sciatic nerve and the things, this is posterior cutaneous nerve of the thigh. Sometimes it comes below the piriformis usually. Sometimes this pierces the substance of piriformis. This is total piriformis like this. Above the piriformis you have got superior gluteal vessels and nerves, and below the piriformis you are having inferior gluteal vessels and inferior gluteal nerve here, and sciatic nerve, plus pudendal nerve and internal pudendal vessels. Pudendal nerve is shown here. Internal pudendal vessels are broken, taken away.
What's about this?
Okay? Pardon? This is total mass of the gluteal maximus. Okay? And you see it is having insertion in the gluteal tuberosity of the femur, and majority of its fibers go to the iliotibial tract. Right? So that's how. So this if you know the preformis, then you can say the structures passing above it and below it. Okay. Then just add to the muscles, like you got here you got gemellus superior, gemellus inferior, and obturator internus, obturator externus, and quadriceps femoris. Now here all the four muscles are fused or jumbled together. You can't separate them because it's preparation technique where gemellus superior, gemellus inferior, and obturator internus and obturator externus, they are jumbled together, fused together, while this one, which is known as the quadratus femoris, this is very much visible. Okay, this is present just behind the hip joint, and sciatic nerve makes contact with it. So this is the total gluteal region. This is your greater sciatic foramen. What passes through the greater sciatic foramen? Piriformis. This is the sciatic nerve, the inferior gluteal vessels and gluteal nerves.
What about
Pardon?
Show hands.
Yeah. So, what's the problem here? Nerves here, in the thigh.
Yes.
Okay. You see, in the thigh you are having two landmarks like this. What is this? Inguinal ligament. Very good. Inguinal ligament or inguinal ligament, whatever you like. In America, inguinal. In UK, inguinal. Doesn't matter. Okay. So inguinal ligament. Right. And below this is your thigh, right? Excuse me.